So primary angle closure disease is a spectrum of diseases consisting of primary angle closure suspects, primary angle closure, and primary angle closure glaucoma. It's characterized by irradiated trabecular contact, or RTC, in the absence of secondary causes. 22% of primary angle closure suspects develop primary angle closure, whereas 28% of patients with primary angle closure develop primary angle closure glaucoma. Hence, it's important to assess the status of the angle. The diagnosis and subsequent management of the patient is based on the angle findings. They can be defined as open, closed, or narrow. In the 21st century, gonioscopy is still the gold standard when it comes to assessing the angle. However, we have ultrasound biomicroscopy, optical coherence tomography, and even Schleimpflug photography to help in assessing whether the angle is open or closed. When it comes to gonioscopy, in the past it was performed to assess whether the angle is open. However, all the recent glaucoma guidelines now state that gonioscopy needs to be performed to assess when the angle is closed, and an open angle becomes a diagnosis of exclusion. There are two types of goniolenses available. The Goldmann type is the gold standard. However, one needs coupling fluid in order to view the angle. The patient's vision is blurred afterwards, and it is hard to perform indentation gonioscopy to assess whether the angle is synechially or appositionally closed. With a full mirror type of goniolens, it requires no contact fluid, the patient's vision is not blurred afterwards, and it is easy to perform indentation gonioscopy. However, it is easy to press too hard on the cornea, which can artificially open up the angle and or blur the view. Before assessing whether the angle is open or closed, one needs to first identify the pigmented trabecular meshwork, or PTM. Sometimes the PTM cannot be seen, and one needs to indent to assess whether the angle is either synechially or appositionally closed. Sometimes the angles look narrow in the primary position, or one can see the angle looks open. But even though one can see the PTM, one needs to ask yourself, can it actually be closed by the iris?
If you enjoyed this lecture so far, please subscribe to http://iop.vision. I hope you enjoyed this series as much as we have putting it together. Thank you.